Today our topic is about the Streptococci. The Streptococci are gram-positive spherical bacteria that characteristically forms the pairs or chains during growth. They are widely distributed in nature and some are the members of the normal human flora. The classification of Streptococci into the major categories have been based on a series of observations over many years. They are classified on the basis of oxygen requirement. Some are aerobes and some are anaerobes. Anaerobic includes the peptostreptococci. Aerobes are further divided on the basis of growth on blood agar. Some have the alpha hemolysis, some have beta hemolysis, and some have a gamma hemolysis. The beta hemolytic streptococci are further are grouped on the basis of last field. In group A, there are include the Streptococcus pyogenes, which contains the M proteins, of which there are more than 80 serotypes. So group A is divided into the glyph types 1 to 80. Group B Streptococci includes the Streptococcus aglati. Group C, F and G includes the Angiosus, and Group E, H and K to U includes the Streptococci normally present into the animals and other than humans. In the picture, you can observe the Streptococcus aglati arranged in the form of gram-positive cocaine chains. Group B Streptococci include the Streptococcus angiosus and Streptococcus pneumonia or pneumococci, which cause the pneumococcal diseases into the human beings, having a severe effects. When we check the strains of the mouth, here we also see the another non-beta hemolytic streptococci, that is the Streptococcus salivarius. This is basically included into the group K. We can also see into the non-beta hemolytic streptococci, the Streptococcus angiosus. Now we come to the strain and culture of the streptococci. But we can also discuss about the group N streptococci, which is also called the lactose streptococci and non-hemolytic streptococci. The individual organism is spherical or ovoid in shape, that is cocci. They are arranged in the forms of chains or pairs, cocci divided in a plane perpendicular to the long axis of chains. Most group A, B, and C strains produce the capsule composed of hyaluronic acid. They are the gram-positive. The Streptococcus pyogenes and other streptococci can be grown onto the nutrient blood and McConkey mediums for only Enterococcus faecalis. The most strains produce the discoid colonies, while the strains with capsular materials produce the mucoid colonies. On nutrient agars, the small translucent dewdrop colonies are present. Onto the blood agars, there are hemolyses which can be seen. They are the non-motile, non-sporulating, gram-positive facultative anaerobes, spherical or white shape, ordinary solid media enriched with blood serum or glucose they can grow. Now we comes to us the different types of antigens present in streptococci. Number one is group specific carbohydrate antigen, which is present in cell wall. The function of this group specific carbohydrate antigen is to precipitate reactions with specific antisera and forms basic for serological typing of last field groups AH and KU. Serological specificity of this antigen is determined by an amino sugar, and this is helpful into the grouping of the beta hemolytic streptococci into the different groups from A to H and K to U. Another antigen is M protein, which is present into the cell wall of organism, producing mat or mucoid colonies. The function of this M protein is associated with the virulence of group A streptococci and gives the agglutination or precipitation reaction with M protein type specific antisera and forms the basis for serological typing of the group A into the Griffith type 1 to 18. Now we comes to us the different types of the enzymes which are present into these streptococci. These enzymes play a vital role in its pathogenicity, includes the streptokinase or fibrinolysis, which is produced by the many group A and B hemolytic streptococci. It transforms plasminogen into plasmin that digests fibrin, and it is partially responsible for rapid spread of streptococci infection by preventing formation of fibrin barrier around the infected site. And this streptokinase can be given intravenously for different clinical uses, including the pulmonary emboli, venous thrombosis, and coronary artery thrombosis. Medically, this enzyme is very much important and clinically widely used into the different medical diseases like the pulmonary emboli, venous thrombus, and coronary artery thrombosis. There are another enzymes which is the streptodonase or the streptococcal DNase, which depolymerizes DNA, thus helps to liquefy, exudate, and facilitate the removal of pus and necrotic tissues. Another enzyme is hyaluronidase or spreading factors, which streptococci have, which splits the hyaluronic acid into the ground substances of connective tissues, thus helps in spreading of infecting microorganisms. Different types of toxins and enzymes are present. The more than the 20 extracellular products that are antigenic are liberated by Streptococcus pyogenes, which can be seen into this table. Different types of toxins are present like the hemolysin and streptolysin, including the streptolysin O and streptolysin S. The beta hemolytic group A streptococci produce the two hemolysins that are the streptolysin O and streptolysin S, which play a vital role in their pathogenicity. Streptolysin O causes the hemolysis only in anaerobic conditions because it is oxygen liable and binds to the sterols into the host leukocytes membrane, where it forms the toxin oligomer resulting into the large transmembrane pores. This causes the release of lysosomal enzymes, which results in degranulation and death of leukocytes as well as destruction of adjacent tissue. It is antigenic and causes the production of anti-streptolysin O antibodies or ASO. An ASO serum titer more than 160 to 200 units suggests the recent infection with streptococci. The hemolysin other than streptolysin O is streptolysin S, which is being oxygen stable as compared to streptolysin O, and it is responsible for hemolytic zones around the streptococcal colonies onto the blood agar point. It is not antigenic. It inhibits the chemotaxis and phagocytosis and exerts cytotoxic effects onto the various eukaryotic cells by binding to the phospholipids into target cell membranes and play a vital role in its pathogenicity. Another toxin is erythrogenic toxin or pyrogenic exotoxins, which produced by the lysogenic streptococci. This is heat liable part, induce the fever and suppress immune system, and have a heat stable part which enhance the pyrogenicity and produce the rashes and scarlet fever. Now we come towards the pathogenesis and clinical findings of streptococci. Diseases due to the invasion by the beta hemolytic group A streptococci includes the erysipelas, which is caused by the invasion of skin, massive browny edema with a rapidly advancing margin of infections can be seen. Number 2 is puerperal fever caused by the invasion of the uterus after delivery. Streptococci enter the blood via wound into the uterus or the endometrius and cause the puerperal septicemia into the mothers. Number 3, they can cause the different types of sepsis and disease due to the local infections include the streptococcal sore throat, which is caused by the attachment of the group A streptococci to pharyngeal epithelium by means of lipoic acid converting surface villi. The clinical findings into the children's include the subacute nasopharyngitis, little fever, and enlarged cervical lymph nodes. And clinical findings into the adults includes the acute and intense nasopharyngitis, tonsillitis, intense redness and edema of mucous membrane, purulent discharge, high fever, and enlarged and tender cervical lymph nodes. Other conditions associated with the streptococcal sore throats include the scarlet fever rashes, which are due to the production of erythrogenic toxin, Quincy, which is the peritonsillar abscess, Ludwig angina, which is characterized by the blockage of air passage by the massive swelling of the floor of the mouth, streptococcal toxic shock syndromes, which is due to the production of erythrogenic toxins. Streptococci are also involved in causing the endocarditis. There are two types of endocarditis, like the acute endocarditis or subacute endocarditis. In bacteremia, beta hemolytic streptococci settle onto the normal or previously injured heart valves, which cause the acute endocarditis, destruction of the heart valves, and cardiac failure. In subacute endocarditis, it involves the abnormal valve deformities, rheumatic or atherosclerotic lesions. Thrombi are formed on injured endothelium of valve leaflets. There are the different post-streptococcal diseases which occurs 1 to 4 weeks following an acute group A streptococcal infections. Number 1 in this the acute glomerulonephritis, rheumatic fever is number 2 and other infections. Rheumatic fever develops 1 to 4 weeks after sore throats with group A streptococci, and it is due to cross reaction between human heart antigen and antibodies directed against streptococcal M antigens. As a result, heart valves are damaged. Laboratory diagnosis of Streptococcus pyogenes includes the different methods. We can use the throat swabs, pus, blood, urine, CSF. In the microscopy, the gram-strain smears from the pus scenes under the microscope, where we can see the gram-positive cocci in genes. They can be cultures onto the different nutrient agar, blood agar, McConkey medium, specially used for the Enterococcus faecalis. On to the blood agars, the different types of hemolysis, i.e. alpha, beta, and gamma hemolysis can be seen. The diagnosis of scarlet fevers can be done by the Shah-Skalton reactions, which is in vitro neutralization test, intradermal injection of anti-erythrogenic toxin in erythematous area. The test is positive. There is disappearance of the rash within 6 to 12 hours. Different types of serological tests can also be done for the detections of streptococci, including the ELISA, ASO, anti-streptokinase, anti-streptodonase, anti-hyaluronidase, or anti-M type specific antibodies. Bacitracin sensitivity test also been done, which is commercially available discs containing a calibrated amount of bacitracin will inhibit the growth of group A streptococci. Group A streptococci is more sensitive to antibiotic bacitracin as compared to the other group A streptococci. Now we come towards the preventions and control of this streptococcal infection. Prophylactic penicillin is indicated only for the patient with specific predisposing factors like SCD, post-splenectomy, nephrotic syndrome, HIV, and congenital immune defects. Prophylactic penicillin is also used in patients with rheumatic heart valves. No specific immunizations with toxoid or vaccine is present. Anti-streptococcal chemoprophylaxis is done in persons who have suffered an attack of वीडियो
rheumatic
पसंद
fever।
आई हो तो इसको लाइक करना, सब्सक्राइब करना और बेल आइकॉन का बटन दबाना मत भूलिए।